and then I'll be delighted to hand over to Chris Castle. Now, Chris Castle has more than 30 years of development experience in the areas of education and health. He's been working at UNESCO in one role or another since 2004. So after holding a position at UNESCO's International Institute for Educational Planning, he transferred to headquarters, where he served as the chief of the section of health and education until November 2022, and where we as the chair have been delighted to work with him. And now we're really excited about his new role as director of the Division for Peace and Sustainable Development, and delighted that Chris can be here with us today to talk about this report that I know he's so enthusiastic about. So team, we're ready for the video, and Sylvia, are we going to you for the video?
Every child has the right to learn and thrive, but for many, poor health and nutrition stand in the way of their well-being, their education, and in turn their future. Investing in school health and nutrition has far-reaching and positive impacts on learners. Yet children and adolescents are still missing out, especially in the poorest countries and most marginalized communities. Almost 1 in 3 schools globally do not have safe drinking water and basic sanitation facilities. And while almost every country in the world is offering school meals, an estimated 73 million of the most vulnerable children still do not benefit from school feeding. We know children and youth learn better when they are healthy, happy, and full from a good meal. Ready to Learn and Thrive was written by the Interagency Group on School Health and Nutrition to show the far-reaching benefits of school health and nutrition on learners' health and education. For example, school meals alone increase enrollment and attendance by 9% and 8% respectively. Deworming and micronutrient supplementation can add 2.5 additional years of schooling in areas where anemia and worm infections are prevalent, and school skipping is reduced by half when tackling school violence and bullying. The evidence is clear. Providing nutritious school meals, fostering a safe learning environment free from violence, promoting physical and mental health, and offering skills-based health education and services are affordable and practical solutions that have ripple effects for learners, communities, and countries, especially when combined. What are we waiting for? We must do more and better together to empower all learners to learn and thrive. Download the report now.
Thank you so much for the video. Whilst the slides are being set up for Chris's presentation, let me tell you the question that we have asked Chris this afternoon, which is, what is the status of school health and nutrition policies and programmes around the world, and what are the main takeaways from your research? Thank you, Chris.
Thanks very much, Dr. Gray. It's a great pleasure to be here and to be with you once again as one of our esteemed UNESCO chairs. It's a wonderful opportunity to share with this group this important question that you've raised, and in fact the report we think helps to do that, which is really designed to kind of give us a better sense of what the status of school health and nutrition is from different countries all over the world. And for many years, we've known that we have different data sources to relate to different aspects of school health and nutrition, but this is really the first time that a report of this nature has pulled all of that data together from over 40 different data sets to present in a comprehensive way, or at least the best we have at the moment, a sense of what the status of school health and nutrition is. So as Nicola mentioned, this report was really a collective effort that was produced with a number of different UN agencies that you saw in that short video, as well as the Research Consortium for School Health and Nutrition, the UN Nutrition Secretariat, and the World Bank. So there were really a lot of different agencies and partners coming together to contribute, to share their data sources, and importantly, to help us think through and analyze what the data means. And I want to also particularly thank Dr. Gray and Dr. Bundy, who's also participating today, who were part of the technical advisory group of 13 experts that helped provide strategic guidance throughout the process. So in terms of countries and schools and promoting health and well-being, we've identified a number of things that I think many of you participating in this webinar will know are important. We looked at policies and laws, we've looked at education for health and well-being, particularly those delivered through skills-based school curricula, as well as extracurricular activities. We've considered the importance of a school physical and socio-emotional environment, and as the short video mentioned, that's safe, inclusive, and conducive to health and learning. And then also considering school health and nutrition services, which is also a key aspect of our consideration. So the report really concludes around 6 key messages that I'd like to share with you today. And again, I'm presenting this on behalf of all the different partner agencies that I mentioned who have collectively pulled together this report, and some of them have also presented the report themselves in other fora. So maybe some of you on this call have even benefited from an opportunity to learn a little bit about this report and its findings already. So I'm going to walk through these 6 key messages, and then I know we're aiming to have an opportunity for discussion. So our first key message is really reminding us that health, nutrition, and the well-being of learners are that is a key determinant of education outcomes and must be an integral part of a good quality education. So it's the first big key message that we've reached through this report is really reminding us all how critical health and well-being are for learners as for them to be able to learn. And again, we know that when children are healthy and well-nourished, they learn better. And when they're not healthy, if they're hungry and suffering from ill health, et cetera, they're obviously not as likely to learn as well. So part of this conclusion also for us was just a reminder that school health and nutrition programs are an effective and feasible way to improve both school participation and learning, and to optimize, significant investments in education. I'm not going to go into a lot of detail, but I just want to mention that, for example, when we have water and hygiene services available or WASH in schools, we can see that between 21 and 61% a reduction in absenteeism in low-income countries. So when WASH facilities are available, there's less absenteeism, quite significantly in some places. And when school meals are provided, enrollment and attendance rates can increase by 9% and 8% respectively. So 8% increase in enrollment and 9% increase in enrollment and 8% increase in attendance. So there's really so many benefits that we know can accrue from investing in the health and well-being of learners through school health and nutrition. Our next key message is that, and here's some good news, almost every country in the world, 90%, implements some kind of school health and nutrition program. And the data very clearly showed us, how much school health is already and has been for many years an important and significant part of programming in schools. And many countries are already implementing a number of these activities. So, for example, UNICEF data shows us that about 70% of low and middle income countries are implementing programs for adolescents. More than 100 countries in more than 100 countries, 55% have school-based vaccination programs, and these have contributed to overall increases in vaccination coverage. And as we saw in the short video, more than 450 million school-aged children are dewormed every year in schools in low and middle-income countries. So lots of things are already happening around the world when it comes to school health and nutrition. However, we also know that despite policy commitments, there's limited evidence to the extent to which schools are able to deliver comprehensive health-related education. So in other words, there's some services, there's aspects of school health being implemented in health education, but it's not as scaled up and consistent as we think it can and should be. And when it comes to school feeding programs, we know that this is the world's most extensive social safety net, and it provides school meals to 388 million children worldwide in 2020. And most recent latest figures released last month tell us that that's now increased to 418 million children in 2022. So really, literally millions and millions of children are benefiting from school feeding programs around the world. Even if we know we have a lot more we have to do, it's not an unimpressive level of investment and action in terms of learner health and well-being. Our next key message really is around the fact that school health and nutrition programs are feasible and they're cost-effective, and they work in all settings and benefit multiple sectors. One of the reasons is because these programs deliver immediate and lifelong benefits for individuals. And they also, of course, contribute overall to the better sustainability and inclusive growth of nations. One example in the report is that school meals deliver $9 in return for every dollar invested. So it's easy to persuade decision makers when we are able to present this kind of data. For every dollar, you get $9 in returns when it comes to school meals, or when it comes to mental health, we can see a return on investment of $21.50 for every dollar. So these are really very compelling and I think persuasive reasons why investing in school health is cost effective and makes sense. Our next key message, though, is that really we need to do a lot more, especially to reach the most marginalized. You know, it's pretty clear that the children and young people around the world who will benefit most from school health and nutrition programs are those who are the most marginalized. And the evidence shows that we can deliver the greatest benefits to the most disadvantaged children and to girls. Programs on mental health, school meals, vaccinations, they're just simply not reaching those who need them the most. And so, for example, in the report, we found that 51% of countries globally provide school-based mental health programs, only 50%. And I think all of us are hearing that you know, mental health is now something that everyone's so much more aware of, particularly after the COVID-19 pandemic and confinements and school closures. And then if we look at low-income countries, it's only 24% who are able to provide mental health services. So really, the need is great. Everyone's acknowledging it much more than ever before, and yet the coverage remains low, particularly in poor countries. Our next key message is that we need to pay a lot more attention to the school environment, and that's really critical for health and to learning. And one of the, I think, standout findings from the report is that almost 1 in 3 schools worldwide do not have access to safe water and adequate sanitation. 1 in 3 schools worldwide. So that's really a major challenge that we need to address in terms of responding to the challenge for so many things, including, for example, preparing healthy and safe meals. So really, you know, water and sanitation, safe hand washing facilities, they're essential for preventing illness and enabling girls to manage menstruation and so many other things, infectious outbreaks in schools, et cetera. So this, you know, paying attention to the school environment is really critical. And again, in low-income countries, they suffer the most from this challenge. And around half of children in schools in low-income countries, are without water services and are found in the least developed countries. So it's really, you know, pretty alarming. And then in addition, there's other infrastructure issues that are important for children with disabilities, and that remains a challenge. And it includes children who, you know, whether it's vision, hearing, or other physical and mental disabilities, obviously those things can affect their ability to learn and their overall general sense of well-being unless they're properly and adequately supported. So that the issue of children with disabilities was something clearly standing out in the data that we found. Let me move on now to the final key message that we had from the report, which is really just that strengthening our coverage and impact requires that programs are comprehensive, respond to context, and are sustained. So as we saw, almost every country, over 90% of countries around the world have school health and nutrition programs going on, but we may be missing opportunities to optimize those programs because they're not as comprehensive as they could be. Their coverage isn't as much as it should be, whether it's urban, rural, or certain regions or districts in the country, et cetera. And they need to really be very specifically tailored to the local needs and context, and then ultimately make sure that we're sustaining these for current and future generations of learners. I think many of us, if not everybody in this webinar, will have heard about the importance of whole school approaches for so many things when it comes to education and sustainable development on a good quality education. It's really also very important for school health. And what we found was that the whole school approach is best established in Europe, whereas in many other places, the whole school approach is not perhaps as well known and understood and being implemented. Finally, in terms of policy and financial commitments, we know these are obviously necessary to sustain comprehensive programs. And and when it comes to school health and nutrition. And of course, there's an enormous value in terms of political leadership. We know that more than 90% of school health and nutrition programs are funded through domestic funds. So countries, are already stepping up to the plate and not relying on external international funding or ODA to support these programs. So that's, I think, important. And then, again, we've talked quite a bit about school meals, just noting that between 2013 and 2020, the number of children who've been receiving meals in school has grown by 9% and by 36% in low-income countries. So we're really seeing, I think, an acknowledgement of the value and importance of school feeding programs. And we hope that other aspects of school health will follow suit and will benefit from a synergy across the board when it comes to school health and nutrition. Maybe just to wrap up and conclude, I think, all of us know that, as I mentioned earlier, the impacts of COVID-19, school closures, and confinement really had an enormous impact. For school health and nutrition, it was also a reminder that schools are more than just places of learning, even if that's their primary purpose. And we, I think, appreciated more than ever before the value and importance of schools to deliver good quality school health and nutrition programs, particularly reaching those who are most in need in the poorest countries. And again, those that are implemented at scale and using innovative approaches to financing and taking into account the importance of coordinated efforts across sectors, not just health, not just education, but agriculture and other sectors is really beneficial and important. And then ultimately, just the importance of improving our own collaboration and coordination. And that's, the interagency group that came together to prepare and disseminate this report has also, as an example of an attempt over the last couple of years to improve our own coordination within the UN system and with multilateral partners, of course, working closely with our civil society partners as well. So maybe I'll stop there, Dr. Gray, but thank you very much for the opportunity on behalf of the interagency group to share the 6 key messages and some highlights from the report.